Hello and welcome to Awaz News. I'm Kubra Ali and I'll be taking you through big news across Canada. Ontario's top doctor goes against own advice while maskless at Toronto party. Teen in life-threatening condition following daylight shooting outside high school in Brampton. Flight attendant who disappeared after landing in Toronto dismissed by airline. Man charged after double shooting inside Vaughan Lounge. Ontario group to challenge $400 a day penalty for seniors who stay in hospital instead of moving to LTC. No idea too crazy, Cabinet given suite of options before invoking Emergencies Act. Health Canada says foreign supply of children's pain medication is on the way. These were the headlines and now let's jump right into the details. An 18-year-old student is in hospital with life-threatening injuries following a shooting outside a high school in Brampton. Peel Regional Police were called to a shooting in the area of Gore Road and Fitzpatrick Drive shortly after noon. The shooting occurred outside in the back parking lot of a high school and is believed to have been targeted, police said. An 18-year-old student from the school is now in hospital with life-threatening injuries, police said. In a statement, the Peel District School Board confirmed the shooting occurred outside Castlebrook Secondary School. Police were called to the scene and are investigating. The student has been taken to the hospital. At this time, we do not have any other information to share, the school board said in a statement. Castlebrook Secondary School staff and school board staff are working closely with Peel Regional Police on the investigation. A number of schools in the area were in lockdown because of the shooting Friday, but those orders have since lifted, police said. The board said it is currently providing support for the students and staff at Castlebrook Secondary. The safety, well-being and mental health of our students is our top priority, the board said. Police told CP24 that the suspects fled in a vehicle, but there is no suspect or vehicle description so far. We know that the suspects fled in a vehicle. At this time, we don't have any further information as far as suspects go, Constable Mandeep Katra said, but our officers are currently in the area investigating, talking to witnesses, working closely with the school board and the members who are trying to figure out what exactly transpired. Katra said, police are actively investigating and trying to locate the suspect, but they do not believe there is a risk to the public safety. Days after strongly recommending the use of masks in Ontario, the province's top doctor was spotted at a party in Toronto without one. In a number of posts to social media, Dr. Kiran Moore, Ontario's Chief Medical Officer of Health, appeared to be in attendance at Toronto Live's 15 Most Influential 2022 list party, where he ranked 12th for keeping COVID under control. In at least two videos posted to the publication's Instagram account, Moore could be seen without a mask on. On Monday, Moore warned of the three major viral threats: COVID-19, influenza, and respiratory syncytial virus currently overwhelming Ontario's healthcare system. All three are actively circulating across Ontario in all of our communities and across the Western Hemisphere, contributing to the pressures on our pediatric healthcare system. As the risk to Ontarians increases, we must use all the layers of protection that we have, Moore said at the time. It should be noted that the province has not introduced a mask mandate. In a statement provided to CTV News, Toronto on Friday, a spokesperson for the Ministry of Health said that, like all Ontarians, Moore continues to evaluate the risk of each situation, including private events. He follows many layers of protection, including screening daily for symptoms of any respiratory infection, practicing good hand hygiene, staying up to date on immunizations, masking when necessary and distancing when possible, the statement read. The ministry said Moore encourages everyone to use their best judgment on when it's appropriate to wear a mask. Meanwhile, in letters sent to the parents and guardians of students dated November 17, the same date as the party, Moore repeated his strong recommendation that all Ontarians, and not just those at high risk, should mask up indoors. Dr. Michael Warner, an intensive care physician at Toronto's Michael Garron Hospital, called out the province's top doctor in a tweet published after the images surfaced, saying the CMOA, Chief Medical Officer of Health, doesn't follow his own advice on masking. Moore is not the only one who appears to be ignoring his own advice. Mayor John Tory was also seen in attendance the same event without a mask. Just days earlier, Tory had said that he continues to follow the CMOH recommendation as well as the city's own top doctor, who has since echoed Moore's remarks. A spokesperson for the mayor said Tory has been wearing a mask in some public settings since the recommendation was made. Meanwhile, Ontario Premier Doug Ford was criticized Tuesday for not wearing a mask in the legislature. At an unrelated news conference in Timmins, Ontario on Friday, Ford said masking is a personal choice. If you are around vulnerable people, you are around young people, that's gonna be your choice. That's what's gonna happen, Ford said. They have been through 2.5 years of this. They know if they need a mask, they know if they don't need a mask. That's going to be up to them. A man has been arrested and is facing numerous charges in connection with a double shooting inside a Vaughan lounge back in September. On September 4th, York Regional Police YRP responded to reports of shots fired inside established 2020 restaurant and lounge located at Langstaff and Western Roads at around 2:30 a.m. Officers located two men aged 25 and 38 years old who were transported to hospital with non-life-threatening gunshot wounds. Surveillance footage from the area viewed by CP24 showed dozens of patrons exiting the venue following the shooting, with some of them running and tripping. It is not known what led to the shooting. In their investigation, police said they'd identified a suspect and subsequently executed a search warrant at residence in Toronto on November 16th. During the warrant, officers located firearm, ammunition, and handgun magazines, including a prohibited extended handgun magazine, as well as quantity of drugs, including fentanyl and crystal meth, YRP said in a news release on Friday. Police said a suspect connected to the shooting was arrested, as well as 4 of his family members who were charged with drug-related offenses. Toronto resident Emmanuel Kafour, 32, is facing 15 charges, including attempted murder using a firearm, discharged firearm with the intent and possession of a weapon for a dangerous purpose. Kafour will be appearing in Newmarket Court on November 23rd. Public health advocates are launching a charter challenge against a new Ontario law that requires hospitals to charge elderly patients $400 per day if they refuse to move to a long-term care home against their will. Bill 7, the More Beds, Better Care Act, forces seniors who are waiting for the space in long-term care home to be temporarily transferred to another home not of their choosing. If they refuse, they will receive the penalty beginning on Sunday. In response, the Ontario Health Coalition is launching a charter challenge on Monday to probe whether the legislation violates rights or freedoms. Despite the title given to it by the Ford government, the act neither provides more beds nor better care. On Ontario Health Coalition Friday afternoon release reads, in Southern Ontario, patients will be transferred up to 70 kilometers away. In Northern Ontario, patients can be transferred up to 150 kilometers away, or if there are no beds available any distance. In September, Long-Term Care Minister Paul Calandra said the bill grants the maximum amount of flexibility for hospital patients who want to transition into long-term care. Health Minister Sylvia Jones said at the time that the $400 charge would be a strong incentive for families to have those challenging conversations. The bottom line is acute care hospital beds need to be for acute care patients, she said. Cabinet ministers did not exhaust every option. They had to resolve the protests blockading Ottawa streets and border crossings across the country last winter before turning the Emergencies Act, a federal inquiry heard Friday. Thousands of protesters rolled into Ottawa in big rigs and other vehicles to voice their opposition to COVID-19 public health restrictions and the Liberal government. After the first weekend, it became clear the protesters did not plan to leave downtown Ottawa, where they set up camps in the middle of the city streets. That's when cabinet ministers convened to review what the federal government could do to end the protests, said Jacqueline Bogdan, the government's deputy secretary on emergency preparedness. It wasn't perfect, but it was there to kind of stimulate conversation on the range of options within federal jurisdiction of things that ministers and departments might be able to think about, Bogdan said Friday. Bogdan testified at a hearing of Public Order Emergency Commission, which is scrutinizing the events and whys that led to the Liberals' mid-February decision to invoke the Emergencies Act. Among the options for cabinet ministers was a national listening exercise like the French government undertook during the 2019 Yellow Vest protests in that country, though the response to those demonstrations also included violent police action. Stiffer penalties were also considered, such as banning trucks and trucking companies taking part in the Freedom Convoy from being awarded government contracts for weeks the protests did not dissipate. The situation is becoming increasingly concerning, it's getting worse and not getting better, Bogdan said of her impressions at that time. On February 9, the clerk of the Privy Council asked deputy ministers to come up with more options to stop the protests. The Emergencies Act was listed as a potential plan B on the final list of options that was considered by cabinet ministers the following day. Federal officials had already been thinking about legislation for years at that point because there was discussion about the possibility of invoking it due to COVID-19 pandemic. Deputy Clerk Natalie Drone told the commission Friday. It wasn't until February 9th that deputy ministers started considering using it in the context of the protests. Minutes from a February 12th meeting of that incident response group shows a list of options using the existing authorities of the government and second list of options that would involve granting new powers to the government and police. The Public Order Emergency Commission, led by Justice Paul Rullo, is tasked with investigating the basis the government used to invoke the act and how appropriate and effective the measures were. The commission is holding 6 weeks of hearings, which are expected to end on November 25th. The commission will hear from the Director of Canadian Security Intelligence Service and 7 federal ministers during the final week of testimony. The Prime Minister's Chief of Staff, Deputy Chief of Staff, and Director of Policy were recently added to this list of witnesses for next week. Trudeau is expected to be the Commission's final witness next Friday. A large foreign supply of children's fever and pain medication is expected to start showing up on pharmacy and retail shelves next week, Health Canada said Friday. 1 million bottles of the children's medication will have been distributed to hospitals, pharmacies, and retailers after next week, health officials said during a media briefing. The initial supplies, including that 1 million bottles, is of acetaminophen for children, and those are the products that are destined for the pharmacies and the retailers, said Chief Medical Advisor Dr. Supriya Sharma. Sharma did not provide a specific breakdown of where those bottles are coming from and where they will be distributed, but she said hospital supply seems to be quite stable now. Hospitals have reported surges in the number of kids admitted to emergency intensive care units. Canada's largest pediatric health center, the Hospital for Sick Kids in Toronto, said last week it was reducing surgeries to preserve its critical care capacity after reporting its ICU had been well above capacity for several days. Health Canada said production of children's acetaminophen and ibuprofen is double what it was last year, but demand is still outstripping supply. Sharma said Health Canada approved 3 proposals to import foreign product, and the supply has already started to arrive in the country. That move was always on the table, but it's been taken up with urgency since the late summer and early fall, she said. Thank you for tuning in. I'm Kubra Ali. I'll see you back tomorrow, same time, same channel. Have a good night.